A single 900, 1,000 word response is still likely to exceed the response limit for this chat. To avoid the script being cut off, here's part 2B condensed in the same warm doctor-style tone. Doctor explains why you're always tired after breakfast. Part 2B, cause number 7, not getting enough protein. So far, we've talked about sugar, refined carbohydrates, dehydration, poor sleep, certain medications, and eating too much. Now let's discuss another common reason many adults over 60 feel tired after breakfast: not getting enough protein. This may be one of the most overlooked causes of low morning energy. Many traditional breakfasts are built almost entirely around carbohydrates: a bowl of cereal, 2 slices of toast with jam, a muffin, a bagel, a glass of juice. These meals may taste good and fill your stomach for a little while, but they often contain very little protein. Protein plays an important role in your body every single day. It helps maintain muscle, supports tissue repair, contributes to immune function, and helps keep you feeling satisfied after eating. As we get older, getting enough protein becomes even more important. Adults naturally lose muscle mass with age, a process sometimes called age-related muscle loss. While this is common, regular physical activity and adequate protein intake can help support healthy muscles as you age. Imagine 2 different breakfasts. The first is a large sugary muffin and a sweet coffee. The second is scrambled eggs with vegetables and a slice of whole grain toast. Both provide energy, but many people find the second meal keeps them full longer and provides steadier energy through the morning. That's because combining protein with fiber-rich carbohydrates can slow digestion and help avoid the rapid rise and fall in blood sugar that some people experience. Protein also helps reduce the temptation to reach for another sugary snack just an hour later. You don't need to eat enormous amounts of protein. The goal is simply to include some source of protein with breakfast most mornings. Good options include eggs, plain Greek yogurt, cottage cheese, nuts and seeds, nut butters, beans, where appropriate, tofu, lean poultry or fish if those fit your eating pattern. If you have kidney disease or another medical condition that affects your protein needs, follow the guidance of your healthcare provider or dietitian. Foods that provide steadier energy. Now let's look at what a balanced breakfast actually looks like. Many people spend years trying to find a magic food that gives them energy. The truth is, it's usually not one food, it's the combination. A balanced breakfast often includes the source of protein, a high-fiber carbohydrate, a healthy fat, plenty of fluids. Think of these foods as a team, each one plays a different role. Fiber helps slow digestion, protein supports fullness and muscle health, healthy fats provide lasting energy. Water supports normal body functions, including circulation and digestion. Some examples include oatmeal topped with berries and chopped walnuts, plain Greek yogurt with blueberries and chia seeds, scrambled eggs with spinach and whole grain toast, cottage cheese with sliced tomatoes and cucumber, whole grain toast with peanut butter and a banana, vegetable omelet with avocado, unsweetened oatmeal with almonds and cinnamon. Notice something? These breakfasts are not fancy. You don't need expensive ingredients or complicated recipes. Simple meals prepared consistently can make a meaningful difference. Another important tip is to avoid drinking large amounts of sugary beverages first thing in the morning. Water is always a great place to start, unless your healthcare provider has given you specific fluid instructions. Unsweetened tea or coffee may also fit into many healthy eating plans. Healthy breakfast habits. Food matters, but habits matter too. Try to eat slowly instead of rushing. Sit down if possible. Chew your food well. Pay attention to when you begin feeling comfortably full. Many people also find it helpful to move their body after breakfast. This doesn't mean an intense workout. A gentle 10 to 20-minute walk, stretching, or light household activity may help you feel more alert than sitting immediately after eating. Another helpful habit is consistency. Eating breakfast at roughly the same time each morning may help your body develop a predictable rhythm. Your body appreciates routines. Small, healthy habits repeated day after day often produce better results than dramatic changes that last only a week. A simple message to remember. If you're always tired after breakfast, don't immediately assume you're getting older. Ask yourself, did I include enough protein? Did I eat mostly refined carbohydrates? Am I drinking enough water? Did I sleep well? Am I eating more than my body needs? Sometimes the answer isn't one thing. It's several small habits working together. The encouraging news is that small improvements can also work together. You don't need perfection, you simply need progress. Transition to part 3. So far, we've explored 7 common reasons why you may feel tired after breakfast. But there are still 2 important causes we haven't discussed. In part 3, we'll explore how low physical activity and vitamin or mineral deficiencies can affect your energy. We'll also talk about when morning fatigue could be a sign of a medical condition, the warning signs you should never ignore, and a simple morning routine to help you feel your best. Stay with me. The next section could help you identify when it's time to speak with your doctor rather than simply changing your breakfast. Medical disclaimer. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If your fatigue is severe, persistent, or accompanied by symptoms such as chest pain, fainting, unexplained weight loss, or shortness of breath, seek medical evaluation promptly. Always consult your healthcare provider before making significant changes to your diet, medications, or lifestyle.